Good morning, ladies and gentlemen, and welcome back to week 6 of the course on sports training, load management, and recovery. This is lecture 2 of week 6, and I'm Colonel Dr. Anup Krishnan, and we will be trying to throw some light on something called overreaching and overtraining. I will be covering this topic under the following headings. Introduction. We'll discuss the supercompensation curve. We'll talk about certain definitions. We'll talk about overreaching, overtraining, the etiology, the pathophysiology, hypothesis, and the conclusion. Successful training involves a specific exercise intensity or overload in order to achieve supercompensation, which is a positive adaptation for improvement in performance. We have seen this in the last lecture, and it must also avoid the combination of excessive training and inadequate recovery. That means we have to give time for recovery. We can't just load the athlete continuously without giving him or her recovery time. If the exercise intensity is too low, the athletes cannot expect to improve their performance. That means we do have to load the athlete, but it has to be an optimal loading. Athletes increase their training intensity to enhance their performance. If adequate rest follows the training session, supercompensation will result. Supercompensation is the basis of effective training programs. We will be discussing supercompensation in detail. If the balance between training stress and adequate recovery is disrupted, an abnormal training response may occur and a state of overreaching may develop. This is the commonest mechanism by which overreaching develops. You keep loading the athlete without giving the athlete adequate recovery time, and an abnormal training response and overreaching is what is going to happen. Let's talk about the supercompensation curve. If you look at the graph, we are plotting fitness levels on the x-axis and time on the y-axis. Now, if you look at the baseline initial fitness level, you start loading the athlete with training. The baseline fitness level drops. It will drop till the training load or training stimulus is continuous. The moment the training stimulus stops, recovery starts. When recovery starts, the baseline fitness level starts to come back up. However, if you give enough time for recovery, the baseline fitness level jumps higher than the initial fitness level and ultimately settles down at a level which is slightly higher than initial fitness level. And each subsequent supercompensations will keep raising the baseline fitness levels higher and higher. This is the basis of sports training, and this is called the supercompensation curve. This phenomenon of the baseline fitness going higher during the recovery period is called supercompensation. And the most important thing to learn from this graph is you have to give the athlete time for recovery and supercompensation to develop. You cannot keep loading the athlete continuously, because when you load the athlete, the baseline fitness level keeps dropping. And if you do not give it time, it will not be able to bounce back into the supercompensation that we require, and higher baseline fitness levels cannot be achieved if you do not give the athlete time. So let's define overreaching. Overreaching is an accumulation of training and or non-training stress resulting in short-term decrement of performance capacity with or without related physiological and psychological signs and symptoms of maladaptation, in which restoration of performance capacity may take from several days to several weeks. Important to note, short-term decrement, several days to several weeks. This is overreaching. Let's talk about overtraining. Definition is similar. An accumulation of training and or non-training stress resulting in long-term decrement in performance capacity with or without related physiological and psychological signs and symptoms of maladaptations, in which restoration of performance capacity may take several weeks to several months. So, overreaching, short-term decrement, several days to several weeks. Overtraining, long-term decrement, several weeks to several months. When we talk of overreaching, we must talk about functional overreaching. It is simply an acute period where training load or intensity is significantly increased. It can be highly beneficial as planned overreaching can yield positive physiological adaptations and performance improvements. Full restoration of performance or improvement will typically occur within 3 to 14 days. Non-functional overreaching is similar to overtraining syndrome in that it lies on the same spectrum and is differentiated only by the time to recovery. Non-functional overreaching typically is caused by a brief period of training overload followed by inadequate recovery occurring over days to weeks. Keep loading, don't give recovery, you will achieve non-functional overreaching. If rest intervals are not incorporated into the workout regimen, this overreaching will progress to overtraining syndrome. Overreaching is often used by athletes during a typical training cycle to enhance performance. Intensive training can result in a performance decline. However, if you provide inadequate periods of recovery, a supercompensation effect may occur. In this situation, the physiological responses will compensate the training-related stress. This form of short-term overreaching can also be called functional overreaching. When this intensified training continues, the athletes go into a state of non-functional overreaching, which leads to a decline in performance, which will not resume for several weeks or months. Eventually, these athletes will be able to fully recover after sufficient rest. Non-functional overreaching is determined quantitatively by the increase in training volume and qualitatively by signs and symptoms of psychological stress and or endocrine disturbances. Overreach athletes in both the functional and non-functional categories can fully recover after sufficient rest. Although it is possible to recover from functional overreaching within 2 weeks, the recovery time for non-functional overreaching is less clear. And this is in line with the classical concept of sympathetic versus parasympathetic overtraining syndrome. There was a concept earlier about sympathetic and parasympathetic overtraining syndrome, which is no longer being considered in vogue nowadays. Patients who were showing more sympathetic symptoms were classified as sympathetic overtraining. Patients who were showing more parasympathetic syndromes were classified as parasympathetic overtraining. However, I would like to stress it is no longer a terminology which is used nowadays. Okay, After overreaching, let's come to overtraining. Functional overtraining will eventually lead to an improvement in performance after a recovery period. When athletes do not sufficiently respect the balance between training and recovery, non-functional overreaching can occur. At this stage, the first signs and symptoms of overtraining syndrome, such as reduction in performance, decreased vigor, increased fatigue, and hormonal disturbances will occur, and the athlete will need weeks or months to recover. There are several confounding factors in overtraining, such as inadequate nutrition, upper respiratory tract syndromes, upper respiratory tract infections, psychosocial stressors, and sleep disorders. The distinction between non-functional overreaching and overtraining syndrome is very difficult and will depend upon the clinical outcome and the exclusion diagnosis. Overreached athletes can fully recover after sufficient rest. Symptoms of overtraining syndrome, such as fatigue, performance decline, and mood disturbances, are more severe than those of overreaching. Etiology. Increased training loads as well as other chronic stresses can influence the neuroendocrine system in a chronic manner. It is not yet clear which mechanism eventually leads to overtraining syndrome, and there are several possible hypotheses for the mechanism of overtraining syndrome. OTS was described as early as 1923, and between 5 to 64% of elite athletes experience overtraining syndrome at least once in their lifetime. Lifetime prevalence is higher amongst male athletes, and endurance athletes are at the greatest risk of overtraining syndrome. Risk of overtraining syndrome is positively correlated with skill level as well as prior incidents of overtraining syndrome. College level endurance athletes report a rate of non-functional overreaching or overtraining syndrome of approximately 10%. Amongst elite athletes, 60% of female runners and 64% of male runners report experiencing at least one previous episode of overtraining syndrome, with a career rate of 33% in non-elite adult runners. In swimmers, 29% had developed non-functional overreaching or overtraining syndrome at least once, with the risk positively correlated to skill levels. Athletes who have developed overtraining syndrome are at a highest risk of relapse. In collegiate swimmers, 91% of the swimmers who developed overtraining syndrome during their first collegiate training season were diagnosed with OTS again within the next 3 years of training. There are numerous hypotheses which have been suggested to explain the pathophysiology of overtraining syndrome, and cytokine, hypothalamic, glycogen, and BCAA hypotheses are the most strongly supported, though I must stress that none of them are definite. Let's talk about the cytokine hypothesis, which is said to be the most inclusive explanation for overtraining syndrome. It explains why overtraining syndrome occurs by presenting a primary cause which affects all over the body, and it can correlate with the symptoms of overtrained athletes. Joint movement and muscle contraction cause tissue microtrauma. This microtrauma stimulates an acute inflammatory response and cytokine recruitment. There is a prolonged activation of muscles and joints without adequate rest, and this can shift the local acute inflammation to chronic inflammation. And the most important cytokines implicated in overtraining syndrome are interleukin 1A, interleukin 6, and tissue necrotizing factor alpha. Cytokines that act in the hypothalamus can decrease hunger, which result in decreased glycogen stores. In addition to appetite suppression, TNF alpha and IL-1A also can account for sleep disturbances and depression due to their activity in the brain. As we can see, the activity of interleukin is all over the body, and this may be one of the best explanations for why overtraining syndrome develops. Hypothalamic hypothesis. There is a hypothalamic pituitary adrenal and there is an hypothalamic pituitary gonadal axis, and any dysregulation or disruption in this axis would account for many of the symptoms which are seen in overtrained athletes. There are drastic changes seen in cortisol, adrenocorticotrophin hormone, testosterone and estrogen levels. And these changes explains the increased susceptibility to URTI, decreased inflammation and increases in catecholamine levels. This is how stress affects the HPA axis and the HPG axis. So basically any activity which affects the hypothalamus will affect the adrenals, the anterior pituitary, the adrenal cortex, and there will be an inhibition of the immune response, inhibition of inflammation, and there may be an energy redistribution. Glycogen hypothesis. Low muscle glycogen can have a negative effect on training and performance by not providing enough energy. Studies have shown that athletes who consume inadequate carbohydrates fatigue more quickly. Decreased glycogen can cause overtraining syndrome by causing increased oxygenation. Decreased glycogen can cause overtraining syndrome by causing increased oxidation and decreasing the levels of BCAA, which are involved in central neurotransmitter synthesis and fatigue development. Athletes who maintain increased carbohydrate consumption during heavy training may still develop overtraining syndrome because the link of glycogen to overtraining syndrome is weak and unsupported. Some physiologists have proposed that chronically elevated levels of catecholamines may stimulate a reduced rate of glycogen synthesis after intense exercise. Tryptophan, the serotonin precursor, competes with BCAA for the same carrier in the blood-brain barrier. Decreased branched-chain amino acid levels allows more tryptophan into the brain, which drastically elevates 5-HT concentration. 5-HT rises so high as to induce a state of fatigue in the individual, as well as other overtraining symptoms like mood and sleep disturbances. Exercise decreases branched amino acids due to oxidation, which should then facilitate increased tryptophan entry into the brain. Athletes have reported feeling more energized and clear-minded when BCAA supplementation is given to them during training. Athletes with overtraining syndrome may actually have increased 5-HT receptor sensitivity as opposed to higher 5-HT concentration. Well-trained athletes are less sensitive to 5-HT, but overtraining syndrome athletes may have lost that adaptation. There are some diseases or conditions which have to be excluded while you diagnose overtraining syndrome. Organic diseases or infections, negative energy balance, insufficient dietary intake, iron deficiencies, magnesium deficiencies, allergies, and triggers. What are the triggers? The triggers may be a training error resulting in an imbalance between load and recovery, monotony of training, too many competitions, psychological issues, sleep disturbance, altitude exposure, and heat stress. Overreaching is the early stage of overtraining and should be diagnosed in the initial stages as recovery is faster and earlier. Overtraining syndrome is caused by sustained overreaching and has several specific signs and symptoms. Endurance athletes are more at risk for overreaching overtraining syndrome. We must be aware of the supercompensation phenomenon and the importance of recovery during sports training. Simply put, it is load, supercompensation, overreaching, overtraining. And the main important factor in all this is inadequate recovery time which is given to an athlete. These are the references which I have used for preparing this lecture, ladies and gentlemen. I strongly urge you to go through them in the interest of better knowledge and understanding. I have finished, ladies and gentlemen. Thank you for your patience. Do let us know your comments and your questions in the email flashing on the screen. Thank you for listening, ladies and gentlemen. Thank you and Jai Hind.